Hi everyone, Dr. Rich Castellano, the Smile Doctor. We're here today with Tammy. Thank you for letting us share your treatment today. We're going to be doing a lifting procedure and some lip plumper. So for right now, we're just doing a little lip filler around the lips, little fine creases. It's definitely going to look natural. When was the last time you had any lip filler?
Oh, at least 2 years ago.
How was it when you had it the last time?
It hurt.
It hurt. Well, we're going to do it different. We didn't do that. We're gonna numb, and I like to do a modified dental block where the lips are at puff puff. But I like it better than the topical cream because topical cream takes a while and doesn't numb as completely. So this isn't gonna hurt.
Okay.
And
I had lumps last time I had it.
And this is gonna feel very smooth.
Okay.
Also, you had a few of the relaxing tablets, like you had a few cocktails. Do you feel the relaxing medicine?
I did.
Yes, she feels it. I feel pretty relaxed too, but I didn't take any relaxing medicine. And then we're going to do the lift afterwards. So my team has everything set up perfectly. And you can see, why don't you show the pictures here. So these are the before. We're going to be doing some tightening across through here. Little plumping through the lips, never too much. So I use the cleanse for the physicians and students that are watching. I like to use the Hiba cleanse and alcohol. It's very rare that you're going to get an infection. I'm going to have you rest your head all the way back. It's rare that you're going to get an infection from fillers, but I still like to use the Hiba cleanse and the alcohol. And then I'm going to be using lidocaine. So I also use a vibration device. Let's see if this one, there we go. So what I do is we're just going to lift the lip here, and you'll feel buzz, and then pinch on 3, 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad?
Small.
Okay, good. So little tiny pinches, we try and make it easier than the dentist's office or easier than getting a tattoo. Patients can tolerate little pinches, and if you need to take a break, you take a break. So I can see the area where I've numbed, and then I'm just staying in that area, and just tiny, gentle inflation of the submucosal area. This, to me, I found is one of the most comfortable ways to do lip fillers because lips are a sensitive area and you want to make sure that the patient is comfortable. If the patient's not comfortable, it's hard to get as good of a result. So she'll be very, very numb. You feel little, small, medium, big pinch there?
Uh-huh.
Which one? Small, medium, big, or not too bad?
Not too bad.
So little pinches. And this takes me 60 seconds, maybe 2 minutes max to do this, whereas you're 30 minutes with the topical. Because patients' time is valuable too. They don't want to sit for 30 minutes. They want to get right to it. And we will be doing the lifting procedure afterwards as well. Now the lips, a little pinching there. The lips are going to feel goofy. They feel like they're extra big. And it's important when you do the modified dental block that you blot and tell the patient there's no drooling. You got you covered, okay? If they feel like you're drooling with the numbness, I'm going to lower your lip here. And so I hold the lip down, buzz, and pinch 1, 2, 3, pinch. Little pinching there. You feel that settle down. You feel small, medium, big pinch? Not too bad?
Not too bad.
Okay. Everything's looking good. My brother's a dentist, so I like to say we try and make it easier than the dentist's office, right? Still have our sibling rivalry. So we like to follow the ABCs of plastic surgery. When you know the ABCs, you will make better decisions. A stands for areas. There's 4 basic areas that we address for the facial appearance. If we lose volume, we fill. That's what we're doing right now. If we sag, we tighten, and we'll be doing the lift next. Sun damage, wrinkles, and sunspots, we can always polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's free facelift. And Tammy knows the power of smile. She's a big smiler. So no drooling. Got you covered there. You doing okay?
They feel real big.
They feel real big, but that's just the numbing. And then after I do that first pass of the submucosal modified dental block, then I just add a little more. Do you feel a little pinch there or not really?
No.
Now I'm testing. Everything's looking good. And then I'm going to do a little numbing under here because this is where we're going to do the lift. You feel small, medium, big pinch there.
No.
So later we're doing the lift, but I've got some of the local. I'm just adding that right now because you do that little tiny incision under the chin. Okay, so now I'm using Bellatero. Bellatero is hyaluronic acid. I call it a fine line filler. The first thing that I do is I try, can you come in closer? I try to treat the little pinch there. How about here? Do you feel a little pinch?
Mm-hmm.
Small, medium, big?
Small.
Small, okay, so little pinch. Just plumping some of the little tiny creases. And then a little pinch here, 1, 2, 3, pinch. And you can see them right in front of your eyes settling down. Little pinch. Corners of the mouth, little pinch. The corners of the mouth is where we downturn. So I always try and put a little bit of volume there. How are we doing so far, Tammy?
Good.
Are we doing better than the last time?
Yes.
Okay, good. Because I know you was really sensitive when she had it done a couple years ago at another place, so. And you can see that crease fill right in. You feel small, medium, big pinch there? Not too bad?
Not too bad.
You feel a little pinch or nothing at all? Little pinch or pressure?
Nothing there.
Corner of the mouth, you feel a pinch. 1, 2, 3, pinch. Little pinch. And there's numbing medicine in the Bellatero. We can't take every crease away, but we try and make it as good as we can.
Okay.
So now I'm going to go the vermilion border, upper right quadrant, lower right quadrant. Everything's looking good. Little pinching there.
Just a little.
How about here? Not really? Okay. So if they feel anything, it's just a tiny pinch. It's very tolerable. But believe me, I've had many patients tell me they've gone to get lip fillers in different places, and it can be very painful. It should not be more than little pinches is what you should feel for lip filler, lip plumper. And you can already see how that nicely defines the border of the lip, and then we're going to add some to the substance of the lip as well. And you can even see the vermilion border start plumping as you're injecting. The most important thing with the lips is that people, they just don't want to be overdone. So we talked about the ABCs of plastic surgery. A for area, tightening, volume, skin, and then behavior is the best. B is the boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. Let's prevent future aging changes, and let's get as much improvement as possible. We can't make things perfect. We're not God. We do the best we can. If we need to come back another day and do more, it's better than going too far. So this is a 32 gauge needle. I see a lot of injectors injecting with 30 gauge needles, which certainly can be fine, but a 32 gauge is less traumatic, less swelling, less bleeding, more control. Very good. This is the right way to do the lips. There are some people that really want to look overdone. Not usually, and we usually talk those patients off the ledge and say, look, you don't want to be a distraction where people can't stop looking at you. Very good. So now that I've done the vermilion border, now I'm going to do the substance of the lip. and your pulse ox is 98, your heart rate is 91, which is fine. How are you feeling? You doing okay? Tammy's tough. Okay, so now I'm in the substance of the lip. I'm just building very gently, very tiny amount. I'm going to do some massage after this. Perfect. A little bit in the substance down here as well. Normally we have the lip proportion 1/3 compared to 2/3 of lower lip show. 1/3 upper lip, 2/3 lower lip. So that's a normal proportion.
I don't feel anything now.
Say again?
I don't feel anything.
Good, good. Me neither. And then you can massage as you're going along. That's the benefit of the hyaluronic acid. You can really mold and massage. Filler doesn't really move. It stays where you put it, but you can mold it a little bit. Very good. For the physicians and students that are watching, you see how traction, counter traction, I'm exposing with one finger and just right underneath the mucosal layer of the lip here. And that's for safety, to keep away from the labial artery. You definitely don't want to inject hyaluronic acid into the artery. So we talked about our ABCs of plastic surgery. A for areas, tightening volume skin behavior. B for boundaries, safety, you must look natural, prevent, and let's get as much improvement as possible. C is combination. If you want your best results, you combine, which is what we're doing today. We're combining tightening with volume. If we want our best results but we only want to do one treatment, then we talk about usually tightening and or laser. And if we want our best results with no downtime, it's filler. Filler does a great job, it gets a great result, but filler will not give us a facelift. And lifting, I get wonderful results, but I can do even better when I combine. So if you understand those categories, combination, solo treatment, and no downtime treatment, you're going to make your best decisions. And of course, we never see ourselves the same way that other people see us. Because when we look at other people, we look at them socially. When we look at ourselves in the mirror, we do not look socially. We look seriously. We look for imperfections. And we can be a little hard on ourselves. That's why people usually go too far. And most of my patients, they don't want to go too far. They want to look refreshed. They want to improve. That's what most people are looking for. Okay, so now, Tammy, why don't you take a look here? Can you see how that plumps the lips?
Oh,
the lips,
wow.
do you like what you see?
Mm-hmm.
So that's good. We're always looking for the wow response.
Mm-hmm.
Now, they're a little swollen. Even if I didn't inject anything, just passing the little needle gives you a little swelling. The swelling goes down.
Okay.
The hyaluronic acid is going to absorb some water. Try and make a big smile for me. The smile feels goofy because of the numbing medicine, but still you look really good. So, are you happy with what you see? Okay.
Yes.
Very
I
good.
can
So we
hardly
did the lip
talk.
filler.
Yes.
There you go. I know. It's hard with the numbing medicine. I try and ask for all the questions after their lips are numb so that it sounds goofy. So we're going to do the lift. We'll have more video coming soon, but thank you for letting us share. It looks really good, and thank you for watching. We're on a mission to stop bad plastic surgery. We're here to raise your cosmetic standards. I'll see you in the next video. Dr. Rich Castellano here at ImmuStuff. Looks really good.